Imagine you come home from class one day. Your dog is coughing and he's been having some trouble breathing lately. He's also been losing some weight. You go to the vet, they do a quick blood test. They tell you he's got heartworms. What could you do to prevent this? How does it get treated after he's already got them? I've been working in an animal clinic for almost a year now over at Murfreesboro Animal Clinic. I'm also a pet owner myself, so I like to make sure that my animals are protected from anything that can harm them. Today I'm going to talk to you about heartworm disease, how it's contracted, how it's treated, and also how it's prevented. Before I tell you how they're contracted, I should tell you what they are. Heartworms are nematodes, which are roundworms. Their scientific name is Dirofilaria immitis. According to Dr. Ward at the VCA, they cause damage by clogging up the heart and the arteries. They truly live in the lungs and then dip down into the heart. The microfilaria are the baby heartworms that go around the bloodstream, and those are what is found under the microscope. These clog vessels that are smaller, and they'll cause damage mostly to the liver and the lungs. Their life cycle, according to the VCA website, starts when a mosquito bites an infected dog. The mosquito gets the larvae inside of it, and the larvae grow in 10 to 14 days. When it bites another dog, it infects this dog with the larvae. The larvae take about 6 to 7 months to grow into adult worms, which migrate up to the heart in the dog. They used to be only located in about the southern U.S., the tropical regions, but more recently, they have spread out to all 50 states. There's been cases recorded in every state. Any state, any area with water is more likely to have heartworms. Symptoms begin in about stage 2, and that's the first symptom would be a cough, according to the American Heartworm Society. Symptoms after that in stage 2 and 3 would be weight loss, lethargy, and eventually stage 4 would be where you get to cable syndrome. Cable syndrome is where adult worms clog up the heart, and they can eventually cause heart failure. In this case, surgery would be needed. But there are successful treatments to cure heartworm disease. There are injections or topical treatments. Imiticide and Diroban injections into the muscle are 2 of the treatments used to kill adult worms. The FDA approves of these as long as vets monitor and administer them. The USDA suggests that multiple visits will be needed. X-rays or blood work could be taken by the vets to monitor the health of your pet. The AKC suggests that you restrict the activity of your pet to make sure that any of the fragments of the heartworms that have been killed don't hurt your pet when they're flowing through the rest of the vessels. Advantage Multi is the only FDA topical treatment approved to kill microfilaria in the blood. Only this kind can be used, and it's often used with the imiticide or the Diroban injections to kill the adults. The worst case scenario would be that class 4 cable syndrome where surgery is needed, but most dogs don't make it through this surgery, so they must be prevented in the first place. It's the best way not to have to deal with all this treatment. To prevent it, there's monthly preventative medications that you can get from your vet. Only vets can prescribe these in the U.S. per the AKC. A yearly blood test will be required by most states. The dog could also be currently on preventative, which means they've taken it in less than the last month. Topical and oral medications are available. Advantage Multi, which we talked about earlier, used in the imiticide treatment, will be used on the back of the dog's neck. This also treats heartworm, fleas, sarcoptic mange, roundworms, hookworms, and whipworms, according to Advantage Multi's website. Interceptor Plus is an oral medication. This is also a monthly medication that the dog should be on year-round. This one treats hookworms, roundworms, whipworms, and tapeworms. It also prevents heartworms. Both of these medications are given monthly, and they should be, the vet should be monitoring the dog, and they should still get the yearly heartworm test even if they're on the medication. There are other medications available, but according to the AKC, you should check with your vet to find the right medication for your breed of dog. Different breeds like Border Collies are more sensitive to these medications. In conclusion, to be a responsible pet owner, you need to understand more about heartworm. You need to know how it's contracted, how it's treated, and how it's prevented. Now, if you recognize these symptoms in your dog or someone else's dog, you'll know exactly what to do. But hopefully with this information, you can prevent any dog from ever getting heartworm. Thank you.
Yeah.